All right. So, hello and welcome everyone again. My name is Talia from the Massachusetts Health Connector, and I'm joined by my colleague Nikki and our Mass Health colleagues Belkis, who will be presenting today's information. In attendance, we also have Melissa from the Health Connector and Abby from Mass Health, who will be supporting with questions. Together, we are here today to share information about health and dental coverage options available for Massachusetts residents. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation's format. Everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 to 40 minutes. Then we'll have time for questions and answer at the end. If you would like to ask a question at any time, please use the question and answer button at the bottom of your screen. We'll be monitoring questions throughout the session. However, we are expecting a large audience and several questions, so we'll do our best to get through them all or address them by themes at the end. Also, feel free to scroll through the question and answers as your question may have been answered already. Please do not share any personal information or private health information when you ask your questions, as others on the call are able to see what you write. If you have a personal scenario that you want to discuss with someone, we'll be providing contact information for the customer service center and instructions on how to find help from a local assister. We are recording today's webinar. Following today's session, you'll receive an email with the presentation, so there's no need to take detailed notes. And now we will get started, and I'll pass it over to Nikki.
Thanks so much, Thalia, and thank you everybody for joining us today. As Thalia said, we are stepping through a presentation called Health and Dental Coverage Options for Mass Residents Losing Access to Employer-Sponsored Insurance. So during today's session, we'll cover what is Mass Health, what is the Health Connector, so that we're ensuring that anyone who's attending has a good understanding of how our organizations are related and also how they are different. We will also review common questions that we have been asked in more recent presentations. We think will be applicable to people who've signed up for today's sessions. We will talk about the application requirements for accessing health coverage in Massachusetts. We'll talk about the coverage options, as well as timeline, when to apply and ways in which you can get help. So I'm going to start with an overview of MassHealth and the Health Connector, and I'm going to ask my colleague Belkis to join in and cover some slides.
Thank you, Nikki. Good afternoon, everyone. So for MassHealth, there are many populations that we serve. For those that may not know, MassHealth provides health benefits to qualifying children, families, seniors, and people with disabilities living in the state of Massachusetts. You may also know that we can assist with paying a portion or all of your health insurance premiums if you are an individual who has employer insurance. We can help to supplement some of the costs for said insurance. We also provide access to doctor's visits, dental coverage, prescription drug plans, behavioral health services, and other important health care services. MassHealth primarily operates in serving two primary populations. We categorize them as individuals and families, or seniors and people needing long-term care services. For today's presentation, our focus is going to be on individuals and families. And this primarily, we serve individuals who are under the age of 65, who are not living in a nursing facility, or individuals of any age who are parents of children under the age of 19, or adult relatives living with and taking care of children that are under the age of 19 that may not be residing with either parent. We also do provide coverage for seniors and people needing long-term care services. And this is typically individuals over the age of 65 that are living at home, individuals of any age needing long-term care services and support in a medical institution or nursing facility, or individuals eligible under certain programs to get long-term care services while living at home. And these are typically individuals with disabilities or members who are married couple where one individual may be over the age of 65 and one under the age of 65.
Thanks so much, Belkis. And I'm going to cover what the Health Connector is. So we just want to be sure that everyone knows that we're the state's health insurance marketplace. And we're here to offer coverage for individuals, families, and small employers who need access to affordable health insurance coverage. So you may be wondering who our audience is, who gets coverage through the Health Connector. And it's primarily people who don't get health insurance through their job, through their partner's job, or any other sources. If somebody loses access to employer-sponsored insurance, the Health Connector is an alternative to enrolling in COBRA coverage. So we'll talk a bit more about that. And want to just acknowledge that a lot of people who apply for coverage through the Health Connector may qualify for help paying. Some people may even be eligible for a $0 monthly premium payment. Now, we're going to spend a lot of time today talking about health insurance, but we want to acknowledge that people can also buy dental insurance through the Health Connector. And when we talk about small employer coverage, that is not going to be covered in detail today, other than to say that if you are a small employer, there is a separate webinar for you. You can check our website or Eventbrite for a Health Connector for Business webinar. And basically, Health Connector for Business is for those with 50 or fewer full-time employees, and you can offer health and dental coverage through Health Connector for Business. But that will not be covered today. So something that both Belkis and I will talk to you about more than once today, because it is a little bit confusing. And we want to be sure that people understand that there is one application in Massachusetts for health coverage for both MassHealth and Health Connector coverage. So you complete one application for those who are under 65 years of age, and you can find out if you qualify for MassHealth or you qualify for coverage through the Health Connector. There is an online application available at mahealthconnector.org. We also have an application, that same application, online application in Spanish, as well as Portuguese. So for the Spanish website, it's mahealthconnector.org/ES. And for Portuguese, it's mahealthconnector.org/PT. So with that, I just want to acknowledge and kind of just reiterate some of the things that Belkis had mentioned. So for MassHealth, we're talking about our state's Medicaid program plus our children's health insurance program known as CHIP. So in Massachusetts, when you combine those two, you have MassHealth. And that's where they could provide free or low-cost health coverage to people who are eligible. And that is administered by the state and funded by both state and federal dollars. It's based on income, it's based on age, disability, and other factors. And this coverage is continuous enrollment throughout the year. And now, again, when you think about the Health Connector, remember we are our online marketplace, and we're available to individuals, families, small businesses. Our eligibility is also based on income, household size, and for subsidies or savings that people could qualify for, it's going to vary based on the household composition. And on the Health Connector side, we do have open enrollment periods and closed enrollment periods, but typically people can get in if they meet certain life events during a special enrollment period. So I'm going to ask Belkis to come back on to talk a little bit about some common questions that she sees.
So some common questions that we receive at Mass Health is first, do you need to live in Massachusetts to apply for Mass Health? Yes, you do. You must be a resident of Massachusetts in order to apply for Mass Health. Being a Massachusetts resident means that you either live or intend to reside in Massachusetts. So typically, if you are someone who does not have a fixed address or you're currently looking for employment in the state of Massachusetts, as long as you intend to reside here and you have a valid mailing address, which can include a PO box, you can apply for coverage. If you are in Massachusetts on vacation or here to receive medical care in a setting other than a nursing facility, then in that instance, you would not be considered a Massachusetts resident because you don't intend to stay here. You're here for a very specific purpose, either for pleasure or to receive medical care and then going back to your address. Do you need to renew your Mass Health coverage? Yes, you need to renew Mass Health coverage on an annual basis. Many cases, people are auto-renewed. That means we're doing it systematically with the information that's provided. So it's incredibly important that members make sure that their information is up to date so that we're able to auto-renew their coverage. Otherwise, you will receive a pre-populated form, which is a pre-filled out form that you receive in a blue envelope in the mail, which you would have to submit to Mass Health within the time frame that's indicated on your letter. So what happens if you get a new job or change your job? You have to let us know. Please make sure that you're reporting any changes to your status, whether that's employment, address, household members. You have to let us know within 10 days of the change to make sure that we are able to update your information accordingly and you get the best benefit that you are eligible for. And we have, once you receive your copy of the slide deck, there is a link to our job update form so that you can complete that if you need to make any changes to your income. So what do you do if your income changes throughout the year? Make sure to update it accordingly. There are links within the slide that you can use on how to make those updates. And you can also contact our customer service line at 1-800-841-2900 to make the updates over the phone so that all of your information is up to date. And I will pass it back to Nikki.
Thanks, Belkis. Now, on the Health Connector side, there are lots of questions we typically get when somebody is losing access to employer-sponsored insurance. So due to the cost of COBRA, because when you are considering enrolling in COBRA, it will be the full cost of your employer plan without the employer contribution. So people always ask, are there other options? And the answer is yes. Instead of enrolling in that COBRA continuation coverage, you might be able to find something that's more affordable for you and your family through the Massachusetts Health Connector. Or you may find that you qualify for Mass Health, or of course, you want to look to see if you may have access to another person's coverage. So for example, if you're married, you may look to find out if you can enroll in your spouse's plan, or you even might look directly to an insurance carrier to see. Another question we get quite a bit is whether or not you can drop COBRA at any time and take up the Health Connector coverage. And there are only certain circumstances when someone who's enrolled in COBRA can end that coverage. So if it's during the Health Connector's open enrollment period, once you lose access to employer-sponsored insurance, you have a special enrollment period. And sometimes your employer might offer you some dollars to help pay for your COBRA coverage. If that's the case, and let's say they only give you those dollars for 6 months or for 3 months, once that money stops, that will qualify you for a special enrollment period. We saw that a lot following COVID-19, where employers would provide a stipend or help people pay for the COBRA insurance for a couple of months. So just know if you're in that situation, once those payments stop, you will qualify for special enrollment period. Another question we get that's important to know is, can somebody get health paying for their health insurance if they purchase a plan outside of the state's health connector? And the answer is no. You can't qualify for federal tax credits if you buy a health insurance plan outside of the health connector. So let's say you shop directly from a carrier. And a lot of times people ask, if I get health insurance from my job, can I cancel my Health Connector coverage? So if you lose access, you lose a job, and then you enroll in Health Connector coverage, and then you get hired into a new position, yes, you can absolutely cancel your Health Connector coverage once you have coverage through your new employer. On this slide, there are just a couple of things that we want to remind you of. And as Thalia said, Belka said, you are going to get all of these slides. So don't worry, you don't have to take detailed notes. But we just want to acknowledge that when somebody loses employer-sponsored insurance, that loss triggers a special enrollment period. So that special enrollment period basically is 60 days to take action, either before the loss happens or after the loss of ESI. And that gives you an opportunity to enroll in a spouse's, a partner, or a parent's employer-sponsored insurance plan. So if you are in that situation, certainly take a look, talk to people in your family to see whether or not that is in fact an option. And remember, it is a special enrollment period that opens that window for you. Many times when you lose employer-sponsored insurance, you can continue their health insurance through COBRA. But as I had said before, it's with full cost to you. And then, of course, the third option is enrolling through Health Connector coverage. And lastly, of course, if you want to shop directly from a carrier. Remember that if you choose to enroll in COBRA, you need to send a COBRA election notice within 14 days after your coverage ends, and you can look to the federal government for additional information on COBRA. And also remember, if you are coming to the Health Connector to see if something's more affordable, you need to apply within 60 days of your coverage ending. Now, when you are choosing between your options, as I had said before, do not forget losing access to ESI is a qualifying event, triggers a special enrollment period. If your employer is offering you dollars, you want to do some comparison shopping, because if that is the case, COBRA might be a good or better short-term option for you because it's a continuation of the coverage that you're in. And then, of course, Health Connector plans could be more cost-effective, so certainly compare all of your options. And lastly, I think on all fronts, don't wait until the last day. Certainly start exploring your options. Know that by submitting an application and looking at the cost of plans and just reviewing what they cover, it's a no commitment process. You can do all of this and choose to do something else. So just want to remind you of that. And now I'm going to pass this back to Belkis. Thank you, Belkis, for taking these slides on.
You're welcome. So we're going to be reviewing application requirements. So as it was mentioned a few times throughout this presentation, we utilize one application to make a determination as to whether you are eligible for MassHealth or the Health Connector if you fall under the category of individuals and families. You would go onto the mahealthconnector.org website, complete the application, and the system will determine if you are eligible for MassHealth or the Health Connector. But by the time you complete it, you will know which program you fall under, and then you would have to take additional steps to to finalize your eligibility if that's what you need to do, or select a plan if you are eligible for either program. Next slide, please. Who should apply? So I had mentioned earlier through one of the questions that we frequently get asked, you need to live in the state of Massachusetts in order to apply for coverage. And that means you either have a fixed address or you don't. Another condition of application are individuals who are U.S. citizens, U.S. nationals, or otherwise lawfully present. If you do not have an immigration status, you can still apply for coverage. It'll just determine which program you are eligible for. You can still apply if you have access to Medicare or other health insurance, whether that be through an employer, through TRICARE, other government insurances. You can still apply for coverage to determine if you're eligible. If you are offered affordable or comprehensive health insurance from an employer, you may qualify for MassHealth even if you have health insurance, because in that instance, we would act as a secondary insurance. And you can also apply if you don't have any health insurance. Next slide, please. So who should not apply? If you are an individual who is visiting for pleasure, such as vacation, or here to seek medical treatment in a setting outside of a skilled nursing facility, you should not be applying for coverage because you would not be considered a resident of Massachusetts. There are some considerations at the time of application. So if you are eligible for other comprehensive health insurance, including Medicaid or Medicare, you will not be eligible for the Health Connector. For individuals who are in jail or prison, they can apply for MassHealth before their release, but they are not eligible for MassHealth or the Health Connector while they are actively incarcerated. So once they are released, then they'll be able to apply and have a benefit. Who should be included in your application? Hopefully we'll have it very clear so that we don't get a ton of questions about this. So individuals that should be included as part of your application are household members who live with you. If you file taxes, we would need to know about the individuals that are on your tax return, even if they are not residing in the home. Please keep in mind that you don't need to file taxes in order to be eligible for MassHealth, Health Safety Net, or the Children's Medical Security Plan. So individuals you need to include yourself, a spouse if you are married, any of your children, and that is natural, meaning biological, adopted, or stepchildren under the age of 19. If you have children with a partner, meaning someone that you are not married to, then you would need to include them on your application if you share children. And if you do share children, then you need to include the children that you share, as well as any additional children that are residing in your household. Make sure to include anyone that it is on your tax return, even if they are not living with you. Anyone you include in your tax return, oh, I already said that. Anyone else who lives in the household that you take care of who's under the age of 19. So just remember that when we're talking about individuals and families, that even if they are not your biological children, let's say you're an aunt taking care of a niece or a nephew, you need to include that child onto your application because you are the caretaker of that child. People who you do not include on your application. So I given the example that if you have a partner that's residing in your household, if you have children together, you add them onto your application. But you would not include that individual if you do not have any mutual children, meaning that you are both not the parents of them. You also would not include that partner's children because if they are not your mutual kids. Unless you do share mutual children and those children are residing in the household. Um, you would not include your parents who live in your household if they file their own taxes. So as our parents get older, sometimes adult parents are living with their adult children, you do not need to include your parents or how you would consider grandparents within your household on your application if they are completing their own taxes. You would include them if you are claiming your parents as tax dependents. So that is the caveat there. And then you would also not include any other adult relatives who you do not claim as dependents on your tax return. Next slide, please. So what do you need to apply? And just keep in mind that this is just something that will be helpful to you when you are applying for coverage, but you are not required to have all of this information available because we have ways of checking for certain information if need be. When you're applying, if you have a social security number, please make sure to have that information available so that you can enter it in as you're moving through the application. If you do not have a social security number, it is okay. There are options that you can select on the application, just indicating the reason why you do not have a social security number. And that can be that you're not eligible to receive one, or you may have applied and are just awaiting the card, or you have a religious exemption. So there are religions where you give up your social security number as part of that religion. It would also be helpful to you to have your current pay information and income information. So if you have any pay stubs, um, for those that are self-employed, their Schedule C off of their tax return, any income resources that you may be receiving, it's helpful to have that information available so that you're completing the information accurately on the application. Make sure you have your proof of address. So that can be a lease, a mortgage statement, a gas bill, any utility bills. So that's information that's helpful to have at the time of application. For those that have immigration documents, it's good to have that information available to make sure that you're entering in your status correctly. And it also allows us the opportunity to check your status during the time of application. And it's good to have available your health insurance information if you have access to health insurance outside of MassHealth or the Health Connector. Again, you do not have to have all of these things available when you are applying because we are able to check electronically um, for these data sources. However, if we're unable to verify your information, then at that point, we'll ask for additional documentation to verify the information that was provided. Next slide, please. What is the best way to fill out the application? Please make sure that you are completing all of the questions on the application. And the reason why we ask that is because oftentimes we encounter members don't answer every question on the application, and that can prolong your process. So make sure that you are answering every question, even if it is not applicable to you. Check off either yes or no, because that's the only way that we'll be able to continue forth to process your application. When you are reporting your income, make sure to enter your gross wages. That means before any taxes or any deductions are taken out. Provide your weekly working hours as well as pay frequency. So we would need to know how many hours you work every week, as well as how often you are getting paid, whether that be weekly, biweekly, monthly, or seasonally. When you are reporting your yearly income, please do not write NA or not applicable, because again, that can hold up your application because we will ask for an actual number as to what you received for the year. If you did not receive any income throughout the course of the year, make sure you write the number 0 on the line, or you can write out the word 0 income so that we know that you did not receive income for the year. Make sure that you are signing and dating your application. There are a few different ways that you can complete an application. One is online, so it takes your signature via the online application. If you are completing your application over the phone, we do accept verbal consent because our lines are recorded at the time of application. We also accept e-signatures. So if you're using Adobe Sign or like a PDF fillable, we accept electronic signatures on those applications when you are completing them. If you need help applying for coverage, there are enrollment assisters as well as MassHealth enrollment centers that you can go to seek assistance. And these, for the enrollment assisters, you often have to schedule an appointment with them so that they can assist you. But the MassHealth enrollment centers are walk-in style, so you can go in and get assistance. Just be prepared to wait because there are many people that come into our offices. Um, and something else that you need to be aware of is that after you complete your application, we may ask for more information. And that can be because we need additional documentation, there are things that we were unable to verify, or that we just need to make sure that we have everything in line so that you can get your benefits as soon as possible. And please make sure to check your mail. It is incredibly important, one, because as I said, we may ask for additional information, or we can be providing you information on the next steps of the things that you have to do to finalize your health insurance coverage, as well as select a plan for either program. So just make sure that you are checking your mail, and we send a lot of it. So make sure you check all of your documents to make sure that you are not missing anything. That way you're not risking your coverage being terminated. Next slide, please. So what happens after you are approved for MassHealth or the Health Connector? So once we receive all the information, we will make a decision as to what you are eligible for and inform you of what program you may be eligible for. Once you are approved, we will let you know if you qualify for MassHealth or the Health Connector. If you are approved for MassHealth, you will receive a blue MassHealth ID card that you can present at doctor's appointments. During the time that you are approved, you have about 14 days in order to select a health plan, and you can do so by going onto our website, Mass Health Choices, and that's a really great tool so that you can compare plans and see what plan would suit your needs best. If you enroll in a plan, you will then receive a white ID card to show at your doctor's appointments along with your blue Mass Health card. Make sure that you are keeping us up to date on any changes that are happening within your household, and that can be things such as income, household size, or immigration. Make sure that you do so within 10 days or as soon as possible so that we can keep the most up-to-date information regarding your particular application. And just remember, every year you have to reapply for coverage on an annual basis. And I will pass it to Nikki to review the Health Connector guidelines.
Thanks, Belkis. So if you do get approved for the Health Connector, there are some different things that you need to be mindful of. You're going to be able to compare your plan options directly from your online application. You also can come back into, this is going to be known to you as a portal or, your web application. You can come back and make that decision later, compare your options, and you can choose the plan, the carriers in your region, and then look at the cost for the monthly premiums that are associated with those plans. On our website, you can see if your preferred provider, your facility, or a certain medication is covered in that plan. So we have a number of tools that you can use in order to confirm those things before you make a decision. Now, after you compare your options and make a decision, you're going to need to select a plan, and there's basically a shopping cart, and you need to place that plan in your shopping cart in order to check out. So if you are enrolling in a plan where you owe a premium, you must make that payment by the 23rd of the month for coverage to start on the 1st of the following month. So as an example, if you were looking for coverage that started September 1st, you would need to make all of these decisions. You need to apply and also choose your plan and make your payment by August 23rd. Okay, So coverage options. I only gave Belkis a little break, and I'm going to have her come back to talk about the MassHealth coverage options, and then I promise I will pick up on the Health Connector.
Thank you. So in Mass Health, we have what is called coverage types. Um, there are four that we're going to focus heavily on. And the reason being is that these are the ones that you will have to select a plan through us once you are found eligible for coverage. So the first is the one that people are most often familiar with, which is Mass Health Standard. It offers a full range of healthcare benefits, covers doctor's visits, dental, vision, as well as behavioral health services, along with programs and services outside of that. So that is the one that most people, especially those that are families, may be eligible for. Next, we have Common Health, and this also provides a wide range of services, but in particular for disabled children and adults who may not be eligible for Mass Health Standard. Then it's followed by Care Plus, and this is a full range of healthcare benefits for adults who are typically single adults or married couples that do not have any children within the household and are not eligible for Mass Health Standard. Followed by Family Assistance, and this offers a broad range of healthcare benefits to certain children and adults, including non-citizens who are not eligible for Mass Health Standard. So these four coverage types, you would have to select a health plan unless you have health insurance through an employer and we're acting as a supplement. That would be the only circumstance in which you wouldn't have to select a health plan through us. And then the last three that we're going to go over are plans that are not considered health insurance for tax purposes. So you have Mass Health Limited, which provides emergency health services to people who under federal law have an immigration status that prevents them from getting more services. Then there's the Children's Medical Security Plan, and it provides coverage primarily for primary or preventative medical and dental services to certain uninsured children who do not qualify for any of the other Mass Health coverage types that I previously discussed. And then lastly is our Health Safety Net Plan, which may help with certain services if you are receiving them at an acute hospital or community health center and are a resident of Massachusetts that is uninsured or underinsured and it does not qualify for any of the other plans that we discussed. And I will pass it back to Nikki.
Thank you. So just a little bit about Health Connector plans. I think, as I had mentioned, since we are the state's health insurance marketplace, you can feel confident that all of the plans sold through the Health Connector meet both state and federal coverage standards. So all of our plans are known as either qualified health or qualified dental plans, and people get to choose from a variety of plans in their region from leading insurance companies in Massachusetts. Now, unique to Massachusetts, we have health plans, or excuse me, unique to the Health Connector, pardon me. We have health plans with advanced premium tax credits. So as I said before, accessing advanced premium tax credits, these are federal tax credits. You can only do that through the Health Connector. And that allows you to, those tax credits allow you to reduce the cost of your monthly premium. Now, only in Massachusetts, we have what are known as connector care plans. And this is for people in lower income ranges who meet other eligibility requirements. And these are low or no cost health insurance coverage options, but they do have comprehensive care. Now, on the connector care side, I just want to note that there are income limits for eligibility. And Connector Care has much lower premiums and copays and no deductibles. So that's really, really fantastic. For individuals, the income limit for Connector Care for this current year is $75,300. For a family of four, the income limit for Connector Care is $156,000 for 2025. So if you are a family of four and your income is less than 156, you should 100% take a look at these coverage options. Now I'm going to give Belkis a little bit of a break here and talk to you about when to apply and enroll for the Health Connector or MassHealth. So when it comes to enrollment deadlines, it's important to note that MassHealth applicants can apply for coverage at any time of the year. So on the MassHealth side, there is no open, there is no closed enrollment. Now, the Health Connector does have enrollment deadlines. So as I had said before, we have an open enrollment period. So typically, open enrollment is November 1st through January 23rd of every year. And then there are things, and then we go into a closed enrollment period. But that doesn't mean that individuals can't get access to coverage. It just means that they need to have a qualifying life event where they can enroll in or change their health insurance plan outside of the annual open enrollment period. So this time is also known as a special enrollment period. And life events that let you qualify may include situations like a change in your household size, a change in income, whether that's up or down, a change in immigration status, or you might be moving from one part of Massachusetts to another. Now, of course, there are other life changes that happen along the way. Someone may get married, have a baby, adopt a baby, or lose job-based health insurance coverage. So if you are a Health Connector member or you are interested in applying for coverage, you want to report any qualifying event within 30 days of it happening. But remember, you have 60 days from the date of the qualifying event to complete an application or to select a new plan. And when you're going through this process, if you do in fact owe a premium payment, the premium payment deadlines still apply, even if it's a special enrollment period. So as I had said before, for coverage that starts on September 1st, you need to apply, choose your plan, and if you owe a premium, pay by August 23rd for coverage to start September 1st. Okay, so where can you get help for with all of your coverage? So I think we said at the outset that there are different ways that you can get help. You can, in fact, complete an application on your own using the online application at mahealthconnector.org. Remember, you don't need to know what coverage you're applying for, but rather just answer all the questions honestly, as accurately as possible, and you'll find out whether you qualify for MassHealth or the Health Connector or not. So you will get a decision right away. If you need assistance at any point in time, you can call MassHealth customer service at 800-841-2900, and the TTY number is 711. On the Health Connector side, you can call 877-623-6765. Now, when you get these slides, you'll be able to get more detailed information. We'll talk a little bit about the MassHealth enrollment centers, also talk about the ability to make an appointment with a MassHealth customer service representative. And also, you'll learn more about the hours of operation of the Health Connector and whether or not we have upcoming events in the community. Now, I'm going to give Belkis a chance to talk a little bit about the MassHealth enrollment centers. Sometimes we use shorthand and call them MECs, but I will let Belkis just describe this a little bit.
Thank you. So we do have 7 MassHealth enrollment centers located across the state of Massachusetts, one in Charlestown, Chelsea, Springfield, Taunton, Tewksbury, Quincy, and Worcester. Please keep in mind that if you are to go to the Chelsea office, there is limited parking. So if you do need to go to Chelsea, highly recommend that you access the MBTA, whether that be a bus line or a train line. When you are submitting any MassHealth applications, you can submit it via mail to our Health Insurance Processing Center, which is PO Box 4405, located in Taunton. Nikki had mentioned briefly about our online appointment system. In that system, currently, you are able to schedule an appointment to see someone in person at our Springfield Mass Health Enrollment Center only. So that's a pilot program where you can schedule an appointment to see someone in person in Springfield. Otherwise, you can do the online scheduler and you can speak with any Mass Health representative. Okay, next slide. And if you don't mind, I don't mind going through this slide, Nikki. Give you
Sure,
a break.
go right ahead. Thank you.
Um, so as we mentioned, you can also access assistance through our community partners with in-person support. There are enrollment assisters and certified navigators located across the state of Massachusetts. This is a free service. They are all trained and certified navigators or certified application counselors who speak a multitude of languages, and that you can get assistance in applying for coverage as well as enrolling in an insurance plan. They can answer any questions regarding your eligibility, the application process, payments, plan details, and more. If you need assistance in person, you can schedule an appointment and click on the link that you'll receive in the slide deck to find the closest application counselor or navigator near you to get in-person assistance. Next slide. And with that, we conclude our presentation, and we're now going to open it up for questions.
Okay. So there were a lot of questions about income and reporting income, what you should include and what you shouldn't include. I know we have some slides in the appendix, but if you guys want to just go over that first.
So when we're discussing income, we recommend that you include all income sources, everything from job, wages, Social Security, as well as self-employment or any severance payments. Currently, the slide that's in front of us, how to report your income. So you can select any of the options provided on this screen. Make sure that you are selecting the income that pertains to you individually for each member in your household. You can select multiple options, such as one-time payment, other income, capital gains. But if you do not have any income at the bottom of the screen, you can continue with no income and select that, and it'll allow you to move through the application afterwards. Something to keep in mind, in case you may have lost your job and are awaiting unemployment benefits, and maybe you receive some sort of a severance package or a one-time only payment, you can select other income as your option. And then if you can go to the next slide. To report one-time only income, you would select the other income, and then there are some options you can select from. If none of those pertain to you, select other, type in the type of income you received, whether it's a severance payment or not. And then for frequency, select one time only and then provide the figure that you were given. Again, make sure that it's the gross payment. I don't know if they are providing you any if they're taking out any taxes or such, if you get that option, but always include it as a gross income when you are reporting it, and the system will do the calculation for yourself or the other household members who receive it. Income sources that we do not count are things such as SSI, which is the Social Security supplemental income, or child support. Those are two income sources that are not countable.
Okay. And then we also had a lot of questions about coverage for students living within Massachusetts and outside of Massachusetts, also students with an F1 visa. So if you guys can just like generally go over coverage for students.
So if you are in the state of Massachusetts, and you do not have insurance through your parents or employer insurance, you can apply for Mass Health or the Health Connector by completing the online application. Um, Keep in mind that you would still need to include all household members, especially if you are being claimed as a dependent on your parents' tax return. So you need to make sure that everyone is included as you're going through the application process. If you are a student who is not being claimed by your parents, but still living in their household, you can complete your own application based on your income and your information. Um, so that is something that you would need to do. If you are a student outside of the state, we you can still apply for coverage. Just know that if you are getting medical care outside of the state of Massachusetts, it will be reviewed on a case-by-case basis because of our providers. And then you
Well,
asked another part of the question.
no, there's another part I think we like to mention to people. If you, let's say the parents are interested in including child who's a college student on their application, I think we like to say on our side at least that the child or the young adult should get their routine coverage in Massachusetts. So make sure you do your primary care appointment, any specialist, etc in Massachusetts. And then, of course, if there's an emergency, it's an emergency. So don't try to think about, I shouldn't say don't try to, because as you said, it's going to be a case by case basis as to whether or not other services will be approved and covered.
Thank you.
Yep. Did that jog your memory? Was there anything else?
I think that's about all of it, but
Okay.
yeah.
Okay. And we have multiple questions about Cobra. When you can if you can start Cobra and then jump over to the Health Connector. If you've lost coverage, when can you join the Health Connector? How soon can you start the process?
Sure. So we covered some of this, but I'm happy to review it again because I know it can feel very confusing. If you know that you're losing insurance in September, let's say, you can start the process right now. You can apply for coverage for us, the Health Connector coverage always begins on the first of each month. So you have to keep that in the back of your mind. However, we don't want to discourage anybody from applying for health insurance for themselves or their families when they've lost a job, because sometimes they might be in a situation where they end up qualifying for Mass Health, or it could be sometimes we call it a mixed household. The parents could qualify for Health Connector plans while the children qualify for Mass Health. And there are different start dates for coverage. So as I said, Health Connector plans always begin on the first of each month. Mass Health plans, I believe, Belkis, it can start mid-month as well, right? If for the kids, let's say we're in a mixed household.
Yeah, so if for children, well, for household members that are eligible for Mass Health, your coverage starts 10 days before the date that you applied. So for example, if you applied, we'll say July 31st to make the numbers clean. If you applied on July 31st for coverage and you were found eligible for Mass Health, your coverage will start 10 days prior. So that'll be July 21st.
Perfect, thank you. And then Lee, I think you had another part of that question, which was, can you take the Cobra first and then drop it? Remember, the answer to that really is no, unless the answer is no, unless you meet there are certain special conditions. So for example, one special condition that will give you a special enrollment period is if your employer was offering some kind of help to you to pay for that Cobra coverage, and then that help ended, then you could drop the Cobra and come over to the Health Connector. Another issue that we see, or situation we see, is when, let's say, someone took Cobra right now, didn't realize how expensive it was going to be. They would have to stay in it until a coverage that starts January 1. So please keep that in the back of your mind because it is a rule. and Cobra can get to be very expensive. In some instances, it makes sense to stay on Cobra. So we don't want to maybe I should say, I want to acknowledge that every situation is different. So you really need to compare your options. And as I had said before, there is no commitment when you apply. You simply apply, see what you're eligible for. It could be Mass Health, it could be the Health Connector, and check out what your options are.
Thank you, Nikki. Okay, someone had a question. Can anyone apply for coverage with the connector or only those who are below a defined income level?
Anyone can apply for coverage. I'm so glad you said that, because remember, it's not just with the connector. If someone wants to apply for coverage and see what they're in fact eligible for, they can they can apply, enter all of your information. Somebody might want to come to the Health Connector whose income is above the threshold for getting help, but they might just want to apply for coverage and buy coverage directly through a particular carrier. So people come to us and just use us as a marketplace. Maybe I should acknowledge that if you know right off the bat you're not going to qualify for any of the plans with savings, there's a shorter application that you can complete. And that just allows you to compare and contrast your coverage options in plans that don't have subsidies to them. But you certainly, as a Mass resident, should use this shopping tool to compare your options.
Okay, and I just want to give Abby and Melissa a chance to share any questions that I might have missed because I know they're still working on the back end. Just answering questions. I don't want to make sure I hit most of the questions, but I think I did for the general themes.
And Belkis, if there are any other, while we wait for them, if there are any other items in the appendix that you want to point out, or maybe it's just good enough to say you are going to get this complete slide deck with the appendix, with links, as well as a recording to the video and the questions that were asked today.
I just wanted to highlight one resource that we have, and that is our My Services app. If you are found eligible for Mass Health, I highly recommend that you create a My Services account. And the reason why I say that is because that is a app that you can access all of the information that you need in the palm of your hand, everything from your Mass Health ID card in case you lose it, to knowing what health insurance plan you're enrolled in, any demographic information we have on file, or any action items that you may need to complete are all located within that application. And especially if you're someone who your address changes, or you're going through life and you may have forgotten to make an update and you may have missed a letter, that's a great way to still access your letters as well as any additional information that we may have on file for you so that you know what steps you need to take in order to rectify your coverage.
Okay, I don't see any questions coming in from Abby or Melissa. I just want to remind everyone, because I see a couple of people writing in the chat or the question and answer, some very specific situations that they had. I just want to redirect them to our navigators and assisters in the community who can help you with those things. And they can sit down with you one-on-one and help you with any questions that you have selecting a plan, really anything at all. I really want to encourage people to use them. And that is all. Thank you everyone for joining us.
Thank you.
Thank you.